So, geriatrics is going to be the study of the aging adult population, and you also will sometimes hear the term senescence used. And senescence, of course, is going to be a gradual decline in a person's overall physical well being, but also their psychological well being and their capabilities in general. So, dealing with the geriatric population, all of the organ systems of the body are going to go through changes. They're going to start to see a less amount of performance. Cardiovascular capabilities won't be as good. Musculoskeletal capabilities won't be as good. The brain will actually decrease in size as a patient ages, as much as 15% through just normal degeneration of tissues associated with the aging process. Ultimately, the patient, as they go through degeneration of the major organ systems, they will eventually get to the point of death. And it used to be that people would die at an older, advanced age, and they would strictly say that the cause of death was age related, or they maybe just were a little more callous about it and even said it was just died of old age. But really, what they're saying though is as the patient ages, again, all of their organ systems are going to deteriorate. They're going to lose brain capacity, neurons, shrink in size and volume. The metabolism slows down. Circulatory capacities decrease quite a bit. The cardiovascular system starts to see the buildup of fatty plaques. That's atherosclerosis, and arteriosclerosis also starts to occur where the vessels become hardened and they lose their elasticity. So that loss of elasticity ultimately interferes with the movement of arterial blood flow throughout the cardiovascular system. Respiratory system decreases. Your patient loses a tremendous number of total alveoli. And remember, the thing about the alveoli is that they are going to be the tiny air sacs that create so much surface area, and each one of those tiny little air sacs, if you could think of this as an air sac, is completely surrounded by a capillary bed, and that's how gas exchange occurs so quickly. These capillaries can quickly pick up oxygen from the alveoli, and the capillaries that have carbon dioxide in them can quickly get the carbon dioxide into the alveoli and then get it out of the body. But as that capillary number gets decreased because the alveoli decrease in number, that in turn decreases oxygen carrying capacity, and so respiratory compromise becomes quite advanced as the patient ages. Kidneys start to lose their functional capability, and of course the nephron is the filtering unit of the kidneys, and the nephrons decrease in number and in serviceability as the patient ages. Even the liver itself, which has so many functions, detoxifying what we eat and helping to process the medications that the geriatric patient may be using. The liver decreases in mass and therefore decreases in capabilities as well. So all of these are part of the normal aging process. And again, we may refer to this as geriatrics. Okay, the gerontologist would be somebody who is a specialist in the aging patient. You may also hear the term senescence used with an aging advanced patient. Talking about some things that people will notice when they look at themselves in the mirror as they age. The skin has elastin fibers made out of protein. Elastin is what gives the skin the capability to snap back whenever you do something like that, pull up on the skin. Well, loss of that elastin protein is one of the things which leads to wrinkles. And so that is something which causes a change in physical appearance, but also that means that the skin is no longer as resilient as it once was, and it's also a sign of lack of oxygenation of that integument. And of course, that's due to a decline in the functions of the circulatory system, which of course can also be referred to as the cardiovascular system, and the respiratory system. The tissues are not getting oxygenated the way they used to be, and therefore the elastin protein is not getting nourished the way that it used to be. We'll also see that people, as they age, due to the melanocytes no longer being oxygenated and nourished in the way that they were before, you may start to see the hair color changing from gray to white. Again, that's a common occurrence in the geriatric patient, and they may have a loss of hair. Alopecia is the term that we associate with hair loss, and in this case, again, the hair follicle in the dermis layer of the integument has to be nourished with a rich supply of oxygen and nutrients in order for the hair bud to continually continually grow the hair. And as it grows out through the follicle, if the hair is not getting that oxygen-rich blood that it needs, as well as all the nutrients that it needs, then it's just not going to produce hair, and we're going to see a lot of turnover and then eventually a loss or thinning of the hair. The musculoskeletal system, of course, is going to decrease as well. Now, a lot of the deterioration in the musculoskeletal system is going to be due to a lack of use. Wolff's law of physiology pretty much states that if you don't use it, you'll lose it. And in particular, Wolff's law applies to bone density and the bones responding to the stresses that they are asked to undertake on a daily basis. If a patient becomes sedentary, which a lot of older patients do become very sedentary, maybe they've retired, maybe they just don't have the friends and the family around that they used to, and so they don't get out and do that much. Well, as they become more and more sedentary, bone mass is lost, and a lot of times bone mass being lost isn't necessarily due to a lack of calcium intake or vitamin D intake. A lot of it is just due to the fact that the body won't use precious resources to maintain bone mass if the bones are not being stressed on a regular basis. So if the patient isn't doing anything like walking, walking is going to cause the forces of gravity to pull against the skeleton, and that alone increases the density of the bones. That would keep the skeleton from holding on to precious minerals. Same with the muscular system. If a person is very sedentary, muscle being so metabolically active requires a lot of effort on the body's part to maintain muscle mass. So muscle mass deteriorates about a half a pound per year. And people tend to gain about a half a pound of weight per year, and that's called creeping obesity. And that generally is the loss of muscle mass and metabolic activity, and in turn that weight gets replaced by adipose tissue. And again, if a patient stays active even throughout their geriatric years, they can maintain bone density, they can maintain muscle mass. But other deterioration that occurs in the musculoskeletal system, joints will start to deteriorate, and we refer to this as osteoarthritis. If somebody has been a laborer for a good portion of their life, the joints that were very active while the person was laboring, maybe they were a mason, and every day they would be slapping mortar onto a wall with a trowel and then putting a brick on that mortar and smoothing it out. And so the joints of their shoulders and their elbow and their carpal joints and the joints in their phalanges, all of those start to deteriorate due to a life of hard work, and we refer to that as osteoarthritis. Also, because of the bones rubbing against each other, the articular cartilage on the end of all of the skeletal bones at the joints starts to wear down, and that can lead to spurs forming. Calcium deposits on the end of our bones are actually a way to try to protect the bones, and so spurs in the joints may also occur and limit range of motion and cause pain. Um, Again, osteoporosis, a very great concern for patients. And osteoporosis is typically more advanced in women than men, mostly due to the female's lack of overall bone mass compared to the man, even during healthy adulthood. But a lot of women may not do strength training or any kind of formal exercise that places stress on those joints and on that bone structure. And so that's another reason why women oftentimes will have a greater amount of osteoporosis, suffer the effects of it more so than what males will. Osteoporosis, to offset those effects, will take a plan of weight-bearing exercise. Of course, just as the name implies, weight-bearing exercise is going to be exercise that the skeletal system is placed under stress, like weight training or walking up steps. Pool exercise, for example, wouldn't be a weight-bearing exercise because the body becomes buoyant in the water, and that actually takes the strain off of the skeleton. Other ways to help offset osteoporosis, of course, is adequate intake of calcium, adequate intake of vitamin D. You can't absorb calcium without vitamin D. And then, of course, biphosphonates like Boniva, Fosamax. Those are all going to be medications which aid the bone retention process. Other continued deterioration effects in the systems of the body as the patient ages include the central nervous system defects. Dementia is basically just a loss of mental faculties, short-term memory, and of course Alzheimer's disease is one form of dementia, but you also get into other forms of dementia such as hardening of the arteries, and that, like we talked about before, arteriosclerosis, where the arteries lose their elasticity. That in turn decreases blood flow to vital areas such as the brain. And of course, the brain being made up of billions upon billions of neurons, each with a very high metabolic rate and each needing a very high amount of oxygen on a minute by minute basis, as well as a high nutrient content on a minute by minute basis. You're going to see a loss of mental capabilities as the patient ages due to arteriosclerosis of the vasculature of the cerebrum. Again, Alzheimer's disease is another form of dementia that's also prevalent in the geriatric population. Brain scan data shows a dramatic decrease in cerebrum mass during episodes of deterioration of the brain associated with Alzheimer's disease. Other areas that get affected in part of the central nervous system, of course, are our special senses. Patients will start to suffer from age-related farsightedness called presbyopia. And of course, presbyopia is what ultimately leads to people saying, my arms just aren't long enough to read this book. And it's because things which are close up are quite the problem for a person that has presbyopia. But on the other hand, they can see things at a distance, which of course we would say is farsightedness. Other eye issues which come about with the aging process include buildup of fluid in the eye, and of course that's called glaucoma. And that pressure in the eye can oftentimes lead to a loss of vision as the patient ages. Cataracts are also a very common phenomena in the older patient in the geriatric population, where an opaque covering of the lens or the front part of the eye, the cornea, occurs. And so in literally from Greek, the term cataract means clouding, and so, or actually it means waterfall, I should say. And much like trying to look through a waterfall, it would cause your vision to be cloudy. Other things which can also occur um, in terms of loss of special senses, uh, sometimes people will have macular degeneration. The macula is a portion in the back of the eye associated with the retina, and the retina is richly vascular. And again, as those vessels start to become hardened and lose their distensibility and ability to transport life-giving oxygen and nutrients to the important cells of the eye, then there's going to be substantial deterioration associated with that as well. And like I said, one form, of course, is macular degeneration, where initially things right in the front of you are lost. You still have peripheral vision, and then as the degeneration continues, it goes to a very clouding situation and a situation where the field of vision has an aura around it, and the field of vision deteriorates, substantially as the process continues. There's also loss of hearing, presbycusis, which is age-related loss of hearing. Again, people that maybe have had occupations where they were around loud equipment, the loss of hearing may be even more substantial than people who maybe worked in a more quiet environment. But again, the geriatric population will see an increase in the number of people with loss of hearing. Sometimes that loss of hearing can be due to the hair cells in the innermost part of the ear. Of course, that's the region where the cochlea is located, and those hair cells actually pick up sound waves produced by the tympanic membrane. And if those hair cells become less in total overall volume, and the tympanic membrane itself starts to lose its ability to flex and cause the malleus, incus, and the stapes to pound on each other, that could in turn lead to the presbycusis, the loss of hearing as the patient grows older. As the patient ages, their other special senses will deteriorate as well. Taste and smell both deteriorate substantially as the patient ages. So all of those are going to be side effects of aging related to the geriatric population. Now, the cardiovascular system, and again, we oftentimes will link it with the respiratory system. We've talked about this before, how in many textbooks that it actually, listed as the cardiorespiratory system. And because ultimately the two are so closely paired in terms of where they are located, but also in the fact that oxygen needs to be carried by the cardiovascular system, and carbon dioxide also needs to be carried by the cardiovascular system, and the exchange of those gases occurs at the lungs. That's why we couple those two systems together. And so blood vessels tend to lose their elasticity as the patient ages. Fat deposits called atherosclerotic plaque will form in the coronary arteries, but also throughout the vasculature outside of the heart as well. Okay, if it's around the heart, we call it coronary artery disease, but if it's in the periphery, that's where we refer to it as peripheral vascular disease. It only goes to show that if we have blockages around the heart, we're also going to have blockages in the periphery as well. So blood flow to the hands will not be as great. Blood flow to the feet will not be as great. Patients that are geriatric patients will oftentimes have to wear socks or maybe something even on their hands because their hands are so cold, because their feet are so cold. So again, that's due to decrease in function of the cardiovascular system. We also talked about, loss of vascular distensibility in the cerebrum as well. Okay, that can lead to a lack of blood flow to the sensory neurons in the brain, and so those neurons, when they lose that elasticity and that ability to get blood there carrying nutrients, that leads to senility and dementia that we talked about. It can also lead to very thin vessels that are brittle, which we could, classify then as this patient having a cerebrovascular accident, a CVA. We also see that as the patient ages, they will typically have uh, primary hypertension. And primary hypertension is going to be different from secondary hypertension because primary hypertension is typically a cascade effect of many issues leading to the high blood pressure, whereas secondary hypertension is high blood pressure related to another system of the body having a disease or failing or being compromised, and that produces the hypertension. But again, that isn't an uncommon occurrence in the aging adult either, because, for example, the renal arteries branching off of the descending aorta would be compromised as the patient ages. And so when those renal arteries start to have less blood flow, then there's going to be less overall filtration of the blood. There's also going to be less ability to balance water in the body, and so a buildup of fluid. That's why a lot of times your older patient will start to have swelling in their feet and ankle, even if they aren't having congestive heart failure. If they sit for a long period of time or stand for a long period of time, they will start to have a swelling in their ankles, and a lot of that is just due to increased fluid volume because the kidneys are no longer regulating fluid balance as well as they did before. Skeletal muscles are not contracting as much, and the skeletal muscle pump, which is the strategic placement of large veins between the biggest muscle groups of the body to cause a milking action when those muscles contract to push the blood back towards the cardiovascular system. If the patient isn't as active, if we have a vessel that's surrounded by a muscle, and each time that patient takes a step, those skeletal muscles squeeze that vessel, that returns blood flow to the cardiovascular system. But in the aging patient that is more sedentary, they have more fluid building up because the kidneys aren't as efficient and the arteries are hardening and becoming compromised. Again, that could all lead to secondary hypertension, and potentially it could be alleviated if a procedure were performed, potentially stenting the renal arteries or doing a graft to the renal arteries, so that way the kidneys got more blood flow. They were therefore able to filter the blood more efficiently, and the patient was able to filter their blood, decrease their overall water, and then that would lead to lower blood pressures and alleviation of secondary hypertension. But primary hypertension, again, is typically high blood pressure without cause. You may also hear it called malignant hypertension. And again, that's yet another common occurrence in the aging adult. Again, it's due to a whole bunch of things occurring. Less contractive force of the myocardium to circulate the blood, less smooth muscle mass throughout all of the vasculature, especially the arterial vasculature, moving the blood through the cardiovascular system when the heart is during the relaxation phase, the diastolic phase. Again, loss of distensibility of the vessels. They no longer can expand and contract back the way they did before. All of those things lead to hypertension in the geriatric population. We've already talked about lack of blood flow to the kidneys and that in turn compromises their ability to do their job. The kidneys will have, nearly half of their nephrons uh, being lost as the patient ages. And again, that loss of nephron numbers will lead to less filtration of the blood, and so therefore creatinine and urea and other waste products, they are going to, be more prevalent in the blood. And again, that also is part of the reason why the urinary system isn't efficient, and it leads to the patient having to get up in the middle of the night and use the restroom more frequently. Uh, Remember, the bladder itself is a bag of smooth muscle, and it has the ability to expand by relaxing that smooth muscle and holding a certain amount of fluid, and then ultimately contracting with the help of the central nervous system and the micturition reflex. And that micturition reflex relaxes the sphincters that ultimately allow the urine to leave the bladder and leave the body through the urethra. And that micturition reflex, while it's causing the sphincters to relax, causes the smooth muscle of the bladder to contract, and therefore you expel the urine. But as we lose smooth muscle tissue, and as it loses its ability to distend, it can't hold as much urine as it was able to during peak years of the adult. Now, the patient may have to get up multiple times through the course of the night because the bladder just can't accommodate the increased amount of fluid volume, which builds up again because of inefficient kidneys, because of the bladder not being able to distend as far. All of those things lead to the patient having to get up more times through the middle of the night. And especially in males, due to the location of the prostate, if this is the urethra leading from the bladder, but if this is the urethra, the prostate literally wraps around the urethra, and it can constrict the urethra so all the urine doesn't get out of the bladder in the male when they do go to the restroom. But also, if this is the prostate and this part is the bladder, as the prostate grows, it pushes up into the bladder, and it makes the bladder feel like it's being stretched because it's filled with urine, and that sends impulses to the brain, and the brain thinks that the male has a full bladder and tells them to go to the bathroom. And so when they get up in the middle of the night and go to the bathroom, there's very little fluid to expel. And if there is any fluid, again, that enlarged prostate constricts the urethra, and it's tough to expel all the urine. So it's kind of a double-edged sword in that way. The prostate grows and constricts around the urethra, and at the same time the prostate pushes up into the bladder, and that makes it feel distended and sends impulses to the brain, in which it tells the bladder that you need to perform the micturition reflex and expel the urine. Okay, and then it stimulates the patient to get up. Okay, and that is pretty much everything that I wanted to cover with our aging population. The geriatric population, again, you may also hear the term senility or senescence associated with an aging population. Other terms that you will also hear associated with an aging population, of course, are age-related decreases of the sensory functions. Sensory functions, of course, are special senses, loss of smell, loss of taste, loss of hearing, presbycusis, presbyopia, loss of vision associated with aging. Will also have a decreased amount of our major organ systems function. Cardiovascular system becomes limited, increase in high blood pressure, increase in fatty plaques building up in the coronary arteries, as well as in the periphery, arteriosclerosis, where we see the arteries becoming brittle with a loss of smooth muscle. We also see a vast number of the alveoli lost in the respiratory system. Again, the compromise in the cardiovascular system paired with the compromise in the respiratory system mean gas exchange is dramatically decreased. And so when we have less gas exchange, that means there's less overall oxygenation of all of the tissues, and things like the melanocytes in the integument are compromised, and so hair becomes white, or gray initially and then maybe white, because again, the melanocytes need nourishment, they need oxygen, and so they can't produce the amount of pigment that they would have at one time, and that compromises the hair in terms of color. But even the patient as they age will go and have alopecia, and that alopecia, loss of hair, is due to lack of blood flow to the hair follicle in the dermis layer and loss of hair growth. So that too is associated with deterioration of the major organ systems of the body as the patient ages. And again, feet feeling cold and hands feeling cold, that's a general compromise of the cardiovascular system and the vessels of the cardiovascular system. The heart is not as strong as a pump as what it used to be. It can't contract with as much force as it used to be. The vasculature is compromised with arteriosclerosis and atherosclerosis, so blood doesn't flow to the extremities as well as what it once did. All of that leads to those age-related deterioration of the organ systems. We also talked about urine function, urinary function being compromised, less blood flowing into the kidneys, potentially due to arteriosclerosis of the renal arteries or atherosclerosis of the renal arteries, and that in turn leads to decreased pressure going into the kidneys, and that means less filtration pressure at the nephron. The nephrons themselves decrease vastly in numbers to the point where there are fewer of them to do the actual filtration, because remember, the nephron is the microscopic filtration unit of the kidneys. That's the real filter, the real at a very, very microscopic level, what filters the blood and ultimately balances electrolytes and water. So as the patient ages, those are compromised as well. Even the bladder itself, because it is smooth muscle, starts to lose its ability to expand with an increasing fluid volume and then contract forcefully. And some of that is due to loss of smooth muscle mass, but also due to, in the males, growth of the prostate gland that compromises the urethra. It causes constricture of the urethra, and that means it's tougher for the urine to flow out of the bladder. Also, the bladder gets pushed upon by the growing prostate in the aging male. That in turn leads to the bladder thinking it's full all the time and sending information to the brain, impulses that tell the brain to enact the micturition reflex. Even if the prostate is not enlarged due to cancer, it's still enlarged due to hyperplasia, and that's where we get the term BPH, benign prostatic hyperplasia, something very common in nearly all males that would be sedentary and the geriatric population. So again, very common compromise of the urinary system. The musculoskeletal system also becomes compromised as the patient ages. Osteoporosis is common, more so in females than males due to their less overall amount of bone mass to begin with. But even in male patients, there will be osteoporosis, maybe due to lack of activity, placing the bones under stress, and therefore they lose the stimulus to maintain bone density, maybe not taking in nutrients. The diet may be poor, maybe a spouse dies that did all the cooking, and therefore the other spouse does not eat as well, and the diet is poor, and therefore they don't get the nutrients that they need. It may be also age-related decrease in the amount of enzymes and intrinsic factor in the gastrointestinal system, which leads to a lack of ability to absorb and utilize the nutrients which are taken in. And so all of those things could potentially lead to a lack of calcium getting to the bone, a lack of absorption of the calcium because of either too little vitamin D or the fact that the vitamin D isn't able to help the patient absorb the calcium. All of these things can be related to the aging patient. The joints also will deteriorate. Osteoarthritis is not uncommon in the aging population. Osteoarthritis, of course, is old age-related arthritis, wear and tear, just from using the joints on a very regular basis that they may deteriorate. The musculature around the joints may deteriorate, compromising the joint as well. All of those things can lead to osteoarthritis. And then when osteoarthritis occurs and the joint and the bone itself become inflamed, then there's the potential that on the ends of all of the bones that come into contact with each other, the articular cartilage will get worn off, and in a way of protecting the bone, the body will actually cause calcium to be deposited on those contact points, and we refer to that as bone spurs, and those may also need to be dealt with to help the patient manage their joint issues. So again, the musculoskeletal system becomes compromised, muscle mass deteriorates, a lot of it due to inactivity as the patient ages. And as again, another thing we talked about also was creeping obesity, a loss of about a half a pound of muscle per year as the patient ages, but that's typically replaced by an even greater amount of overall weight gain, which of course means that's all fat weight, and increased weight puts more joint stress in key joints like the hips and the knees and such, and that too leads to deterioration of the joints. But that's an overview of the aging population, geriatrics, and I just wanted to go over that material and then summarize it at the very end. So the